All right. Hello, this is Randall Krim, and I am doing a focused assessment on a head, eyes, ear, nose, and throat on my pediatric patient. Can you state your date of birth?
9/13/2007.
All right, so this is Kyler. He is 16 years old, and he agreed to be my participant in my video here. So before we started, I did wash my hands, and then we checked vital signs. Vital signs were 114/64, heart rate was 58, and respirators were 14. Past medical history is celiac disease. All right, so we're going to start with our head. The first thing I'm going to do is take a look. Have you ever had any head trauma?
Nope.
Do you have any problems currently? Pain anywhere?
Nope.
Okay. So just taking a look, looks like hair is distributed equally. There are no areas visually that stand out. So now I'm going to go ahead and assess. I'm going to move the hair. Scalp looks healthy. There are no bumps, lesions, bruises, anything noted. And as normal, look, and head shape is normal. All right, so next thing we're gonna do is we're gonna take a look at the eyes. So again, just looking at the eyes, or you have any problems with your eyes?
Nope.
All right, have you had any injuries to your eye?
No.
Okay, and any surgeries?
Nope.
Okay. So just taking a look, looks like all of his ducts are clear. His nasolacrimal duct is clear. There's no drainage anywhere from either of the eyes. They are symmetrical. Eyebrows, as we look in the eyebrow, the hair is distributed evenly. So I'm going to go ahead and pull out the pen light here, or the otoscope. And we're going to take a look. All right. All right, so his pupils are equal and they're reactive to light. Pupils are about 3 centimeters, like can be expected. So I'm going to have you first just tell me, just look at me, tell me when you can see my finger.
I can see
it. All right. Excuse me. All right, same way, just look at me, tell me when you can see my finger.
I can see it.
All right, so good peripheral vision. All right, we're gonna check the cardinal field to gaze. So actually you can just start by watching my finger only with your eyes. Do not move your head, just follow my finger with your eyes. All right, so his gaze field is normal. He's able to follow my finger without any complications. What I want you to do now is just keep an eye on my otoscope here. And as I bring it in, I just want you to keep an eye on it. All right, so no stirred business. Both eyes remain focused on the object. And he also has, his eyes are accommodating. All right, so that's good. And the redness, it was a little bit darker. I mean, check the red reflex. I can't really see it too well. Actually, I saw it right there. So he does have the red reflex. So, all right, now I'm just gonna feel around your eyes. All right, so there's no lesions, bumps, any masses noted around the structure of his eye. Okay, so next we're going to move on to assessing the ear, or ears. I guess he has two of those. Excuse me. All right, so any problems hearing?
Nope.
Any problems with your ears, frequent ear infections, anything like that?
Nope.
All right, so just looking at his ears from here, they are symmetrical. I want to take a peek at each of his ears. And no drainage noted. No anomalies. There is no piercings in his ears. So I'm going to switch my lights here, and then we are going to take a look. First, I'm just going to feel your ears here. No pain when I touch it.
Nope.
Nothing behind. Okay. So if you look towards the wall, I'm going to take a peek in your ear. Tympanic membrane looks good. It's pearly gray, translucent, shiny. And the left ear. So there's no anomalies on the external structures of the ear. Taking a look on the inside. Again, tympanic membrane looks good. It's pearly gray. Translucent, shiny. So the ears look good. I'm gonna whisper a couple words. So we're gonna do a excuse me. Let's do a whisper test. So I'm gonna have you plug one ear. I'm gonna whisper a word. I just want you to repeat the word out loud. Yellow.
Yellow.
Good.
9.
Okay. All right. So the whisper test did well. All right. So we're gonna take a look at your nose next. Now, just looking at your nose, everything looks again symmetrical. Nares look symmetrical. So that's good. Any problems with your nose? Any injuries?
Nope.
All right. I'm just going to feel first. All right. So there's no edema, no lesions, no masses that can be felt. Everything feels normal. Sinuses are not edematous. All right. Can you tilt your head back a little bit? All right. Again, nares are both equal in size. Right. So all right. So the mucous membranes are moist. There's some hair up there. So I want you to pinch off on your nose and breathe in and out. And do the same with the other side. All right, so the air passages on both sides are also clear. All right, so next we're gonna move down to the mouth. If you can, first of all, take a look at it. The normal mouth looks good. There's no drooping. So I'm just gonna have you go ahead and smile. All right, so just feeling the TMJ feels normal. All right, so give me a big smile. And can you open your mouth for me? All right. Can you say ah?
Ah.
All right. So cranial nerves 9 and 10. So the are both normal. Go ahead and say it again. I would check the gag reflex. I do not have a tongue depressor to check the gag reflex, but he does not have any history of any issues with aspirations or not having a gag reflex. Looking at his dentition, everything looks good there. Palate looks normal. Can you stick your tongue out for me? Mucous membranes are pink. Tonsils, adenoids are non-edematous. Can you lift your tongue up? Again, moist. And cranial nerve 12 is also intact. Okay? All right. Thank you. All right. Next I'm going to do is I'm going to have you swallow. Okay, swallow again. You can do it one more time. All right. So swallowing without difficulty. Also assessing the thyroid, palpating thyroid. Thyroid feels good. No non-tender, any pain when you swallowed. No pain when I'm pushing. Okay. So thyroid is non-tender. Again, non-edematous. All right. So I'm just looking at his neck. Everything looks good. So we're going to check the range of motion of your neck. So if you can tuck your chin down to your chest, and can you look all the way up to the ceiling? Can you touch your ear to your shoulder? Can you touch your chin to your shoulders? All right. Good range of motion with his neck. I'm gonna palpate. Excuse me. Sorry. Excuse me. All right. Sorry. Go to palpate your lymph nodes here. All right, so lymph nodes are not enlarged, which is what we want. I'm going to check his carotid pulse. It's normal rhythm. So both carotid pulses are intact, and they have a good rhythm to them. And last is just looking. We checked the trachea and it did this, but just volume trachea, Adam's apple was noted there. All right, and everything is good there. We did evaluate that when we did the swallow test as well. All right, any questions for me?
No.
Cool. All right, so far as immunizations are concerned, for your age, if you weren't caught up with your other immunizations, then we would want to make sure that you're up to date with all of those. However, I do know that you are up to date with your immunizations. So looking forward, you need to receive your meningococcal vaccine, which is meningitis, is a virus that can do some some pretty terrible things to people. So that is a requirement both for school and if you go to college. That is a requirement for colleges as well to get your meningococcal vaccine. Also, the COVID vaccine boosters are due annually, and also the influenza vaccine once the flu vaccine begins.
Okay.
All right, which is in September. So should receive that. Anticipatory guidance moving forward for your age, your driving. So you want to make sure that you're always wearing your seatbelt. You want to minimize the number of individuals, friends that you have in a car,
Okay.
and limit the amount of nighttime driving, as most accidents for teenagers occur at night.
Okay.
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 Getting proper amounts of sleep, 8 to 10 hours uninterrupted, preferably, will help you out both at school and with your physical activity. You want to try to maintain physical exercise at least for 1 hour every day. And then nutrition is also important, so you want to eat 3 well-balanced meals. I already said 3, but 3 well-balanced meals each day. And then make sure you're staying hydrated with water.
Okay.
Okay?
Good.
All right, any questions?
Nope.
All right, so for ICD-10 code, we'll use the Z00.129. That is just a routine child and with no abnormal findings. So that is the ICD-10.
Okay.
All right, thank you so much.